Hi, Dr. Kaur. Hi, Dr. Mukhara. How are you? How are you both?
Hi, Divya. How are you?
Hey, good. How are you?
I am good.
Good.
So I am all ready for the camera. I just quickly checked it. If other people have it on, like, I don't know if the participants would have it, the availability to turn their cameras on. I don't mind turning it on for them to feel comfortable. I'm all ready for
Yeah.
it.
Okay, perfect. Dr. Mukhara, what about you? Will you be coming on video? Because I think both of you on video would be great. But yeah, up to you guys. Can you guys also see? You can see my screen, right? You can see the slide.
I can see the slide. Yes, I'll turn my camera on so you know kind of
Okay.
how everything
Perfect. Okay.
pans out. I don't see myself though. Can you see me?
No, I think because I'm screen sharing, I can't.
Okay. I don't know if it matters then, I guess, if we would be screen, but would you have, do you have the slides or anything with the questions?
No. Just
Okay.
Yep.
So I guess if we are both doing the videos, then maybe we can stop the screen sharing and people can
Okay.
see us.
Yep.
If not, then we'll just, oh, there I go.
No, let's
I
do
can
that.
see
Perfect.
myself now.
Okay.
Perfect. Only if we both are, then like people I know that kind of tend to feel a little bit better connectivity wise, and we know like, hey, like I want to say something, and then it just feels a little bit more natural conversation instead of trying to see like
Perfect.
whose turn it is. Okay.
Hey everyone, I see some people starting to come in. Thank you for joining. We'll just take a couple minutes before we start. Just waiting for some folks to join. So thanks for coming.
Hi, Dr. Mukhara. How are you?
Hi, I'm doing fine. Hi, Dr. Kaur. Nice to meet you. And it's
Nice to meet you.
yes, and thank you, Divya, for organizing everything. And it's a nice opportunity to be here and discuss the importance of mental health. I hope more people will show up, and it'll be a good resource for people who are trying to look for help. I know people always try to reach me personally asking for help, but so at least it's a good way, like they can know about when to ask and where to reach. So let's
Absolutely.
hope more people will join. So, do you want to wait some more time, Divya, or I guess?
Oh, we'll give it a couple more minutes. Maybe we'll start in a couple more minutes.
Okay.
Yeah, we can pause our camera still then, or just keep it on.
Sure. Yep. I'll let you guys know when we'll start.
Okay.
Okay.
I think we can get started, and people will come in as they come. If we're okay with that, I think we can kind of get started. Since we're recording, you know, the playback will be available for everyone as well. So, okay, sounds
Sure.
good. So can everyone hear us? Everyone's able to hear and see. Just want to.
I can hear. Yeah.
Okay, perfect.
Yes.
Okay, let's get started. So, welcome everyone. Thank you everyone for joining today. This event, we're calling it Let's Talk. It's our mental health symposium featuring Dr. Kaur and Dr. Mukhara. So thank you both for your time today and joining us. We really appreciate it. Mental health awareness is really important, and May is Mental Health Awareness Month. So we're hoping that we can talk about the prevalence of mental health in South Asian communities, and also take some questions from the audience. You know, I know a lot of people, Dr. Mukhara, as you mentioned when you joined today, that a lot of people want to reach out but don't know where to go sometimes. So I think hopefully this is a, you know, a fun event for everyone to kind of get to know more. So maybe we start with introductions. Dr. Kara, do you want to go first with your introduction?
Sure. Thank you. Thank you, Divya, for inviting me to be part of this talk. I think it's very important to have this talk for our community. Great opportunity. Hello, everyone. I am Dr. Gurpreet Kaur. I am a licensed professional counselor in 4 different states: Virginia, DC, New Jersey, and Pennsylvania. And I have been providing individuals, some couples, and very little family counseling for over 10 years now. And currently I am practicing in New Jersey. And for the past year or so, I have been distant. So, or telemental health, telehealth, telemedicine, the new terms that we have come to acquaint with. And I have been seeing a much broader population than I have been used to. So thank you for having me here.
Thank you so much. Dr. Mukhara, you as well, please, your introduction.
I'm Dr. Hema Mukhara. I went to medical school in India, and after my MBBS, I joined the UTMB residency program. I did my general psychiatry residency and completed my fellowship in child and adolescent psychiatry. I'm a board certified child psychiatrist practicing in the Ashburn area. I have worked in juvenile justice system. I was a consultant for Harris County Juvenile Justice Department. And I've also worked as inpatient medical director and also worked for a residential facility in the past. But for the past 10 years, I've been primarily doing private outpatient child psychiatry. My primary area of focus is children. So I typically see age group from 5 to 18 for medication management. And I see some young adults also who I continue to see after I have seen them for a long time. But my primary area is medication management for children. And I'm happy to be here. I really hope this discussion will be resourceful and people will know how and where to get help when needed. So.
That's great. Thank you both so much. So I will start off with a few questions for our panelists today. I guess the first one is, what is mental health and why is it important? Why is it important to talk about?
I don't know. I mean, for me, I can probably first start with how I see, and then I'm sure Dr. Kaur can explain her version of how she sees it. Mental health is basically social and emotional well-being. I see it as how, it's basically how a person functions, in the society, how they function in their home environment, how they interact with people around them, and how they work, how they perform in a work setting. All these is related to our mental health. So it's basically a description of overall functioning of a person. That's how I see mental health.
Yes, thank you, Dr. Mukhara, for elaborating on that. And just to kind of piggyback on Dr. Mukhara, I also see mental health as kind of emotional resiliency, or having some coping mechanisms to be in the social setting with your family, and as well as how to keep a balance with work and life. And it's kind of in a short terms or a nutshell, it's your ability to pivot, right? Life happens, and it happens to all of us, but ability to be able to pivot that and come back as soon as possible or bounce back as soon as possible. That's how I see what mental health is. And why it's important, I think it's important just to live life, you know. It's important because you want to have a work-life balance. It's important because you want to have healthy relationships with your partner, with your children, with your parents, with your friends and coworkers. If you are not well, right, you are at the center. And if you are not well, then other people and other relationships and anything that's united to you or connected to you isn't well. So and usually we kind of respond more to physical illness or physical health, that, oh, I gotta work out, which you know helps with mental health as well, but other things as well, that we tend to focus more on the physical side or physical health. But mental health is also very important to have a good physical health as well, because if, you know, we'll go into the symptoms and stuff later on, but if you're not feeling well, you cannot take care of your body. So that's how I see it.
Thank you. That was great. Yeah, it's definitely, something that has been really coming into the spotlight, I think more so than ever, given COVID and all the implications that it has. So let's maybe talk a little bit about in our society, so we can generalize it to even any society, specifically to the South Asian society. Why do we think that mental health is, like, talking about mental health is a taboo? Like, why shouldn't it be? Why should we normalize talking about mental health, getting help for mental health?
I mean, so see, brain is such a powerful organ, right? So anything that is seen as a defect to the brain is seen with fear. And I think partly that is one of the reasons why, I think people are scared of label themselves as mentally ill, because they don't want to be perceived down or negative, and there is also a general perception, like community wise, I think there's labeling of mental illnesses. There are different terms that people, a lot of derogatory terms that's being used and being labeled. And I think people don't, so when they are trying to seek help, they're fearful of being labeled into that group that, that scares them. I think, so the perception of the community is also a deter for people to get help. So that is another other reason. And I feel like the perception comes from the lack of knowledge. If people are educated about mental illness, the way they see things will be different. And if they're able to see it the right way, the perception changes, and that will motivate more people and be open to ask for help. So, in reality, like in practice, like only a handful of people are really like psychotic people that people label as mental illness that we see. Majority, more than 95% of the people that we see in practice are people who live around us, people who are struggling with different aspects of their life, not able to manage, like interpersonal relationships, their job, or, certain areas of their life is being in trouble because of lack of coping skills, or, not able to deal with that. So I feel like if people are able to normalize that as it's normal for anybody to have these issues, and sometimes it goes overboard where it is okay to get help and reach out for help, and if they're able to perceive that in a more normal way, I think people will be more open to ask for help. So I think the negativity, the social inclusion is the key here, to bring down the stigma. So that's how I see it.
Great. Okay. I think Dr. Mukhara has covered a lot there. The only thing that I want to add to that, that I think Asian Indian community, or in general, I think just even East Asian countries, we are very family oriented people, and individualization is not part of our culture. So I think even if one person is suffering and might need help, we see it as it's the whole family, that might be or would be looked down upon, that not just that as a person is struggling, but the whole family is struggling. So I see a lot of that with Asian Indian communities, or kind of individuals who I treat, that they just don't seek out help because their parents don't want them to. I do see teens a lot. Usually the behaviors kind of come out when they're getting trouble in school, or they're not listening to their parents, right? Or the behavioral stuff comes out, but underlying other symptoms, maybe they feel disconnected, they don't see their children, that they are disengaged or disconnected or low on energy. We don't pick up on those cues because we are not trained. One, we are not trained. We don't want to, as Dr. Mukhara said, that, we just think that brain is powerful, and then anything with that is illness. Very low percentage is really mentally ill, that might hinder their daily performances. But otherwise, it's you and I, at the end of the day, who is overwhelmed and who is frustrated, irritated, and just work-life balance might not be there. So it's hard to cope with those things. And we think that we just have to push it through, we just have to, that we obviously don't get the manual of how to live a healthy, fulfilling life, but we just have to figure it out, right? We just supposed to know. So I think those couple of things just get in our way, that we see anybody else telling us how to live a life is seen as in a negative light.
Yeah, that's a great explanation for that it's really something that affects everyone. It doesn't discriminate. It's not based on, and I think the other thing to remember is that there's nothing wrong with you if you are experiencing this stuff. It's completely normal. And I think the more that we spread that message that it's okay to get help, it's okay to sometimes like take it slower and take a break from things, and get help, I think it'll really help. So and I think particularly now, so pivoting to like, how has COVID-19 really affected and impacted mental health, both from a people perspective and from a practitioner perspective? The impact of no social interactions, isolation, the stress of the pandemic. How have you seen that reflected in your practices?
So I can speak for children because I primarily see children. The main change with the COVID-19 is the online schooling, which is a big challenge for kids with ADHD. The monotony of being, having to sit in front of the computer all through the day, and to be able to pay attention and keep up with schoolwork, being organized, and then having to do all the assignments in computer again for another extra few hours in the evening. I mean, that is a big challenge for kids with ADHD. For them, they really need that getting out, going around people, talking to people. That interaction, social interaction, is emotionally, is needed for them. And I feel like, so a lot of kids, those kids have struggled a lot. I see, there has been big drop in grades that's reported by parents, because of the kind of instruction, and also the quality of education. Of course, like, it's going to be different, compared to in-person learning. So that's one thing. I've also seen a lot of depression, anxiety that has come up lately. I think partly, the nature of the illness and the outcome, and the fear of how it affects the family members, all those can worsen somebody who has anxiety or OCD type of behaviors. It scares them, and the washing behaviors have kind of went up like several folds. And kids getting worried about parents dying from it, parents losing a job, the financial status of family getting affected because of that. All those things have definitely has peaked a little bit more in children. I've definitely seen that. And hopefully, like lately, the hybrid, has been back. So that's been helping some of the kids to get back on track. And so, I mean, and for the practitioners, I mean, I think the most who are affected are the frontline workers, I would say, the doctors who are really seeing these patients on a daily basis, working very hard, extra hours, and just seeing the death of the patients and the family. That's just emotionally burdening as a physician. Not just having to take care of the medical part, that for themselves to deal with that emotionally. I think it's really hard. I think the most hit, as we all know, are the frontline workers at all levels, like from physicians to the from top to all levels. Clearly, they are going through a lot, and so it's definitely a difficult period. And like for us, like, of course, the number of patients have gone up, but it is, I think, when it comes to child, there's no matter, like, I think there was always been a need, and I feel like it's always busy. I don't know if it really changed so much, but clearly there has been increase in anxiety and depression related to COVID in the recent few months. So I don't know about adult patients. I know you see a lot of adult too, right? Do you? Yeah.
Yes, I do see adults, and I do see quite a bit of nurses and physicians, as well as teachers. So I have been busy. So teachers and then the healthcare workers, they have been our front line, absolutely. But even outside of that, adults have been suffering. So I'll speak on like the frontline workers. It's yes, a lot of the existential stuff has come up, because in counseling, because we talk a lot more about the depth stuff instead of just the symptoms, so mortality and death and other existential concerns, all those have been on rise, and anxiety about those things are brought up. And I think the pandemic in itself, it has tested our limits, from all around, whether it was working, whether it was family, whether it was just individual personal stuff and other relationships, or feeling just isolated. Like, if you are stuck at home with your spouse and kids, that was tested to its limits. Or you are home alone, you're a single person and you cannot keep on with your social life. And I have a good handful of those individuals as well, that they just feel isolated, and that's just so existentially concerned for that, for what life is, and why are we here, and what are we doing. So I think it just has tested us all from all different angles, and it has tested our ability to bounce back or pivot, because it has been going on for such a long time. Usually when crisis hits, it's for a small period of time, but we have been in crisis for more than a year now, and we don't see so much of the end of it. We are just adapting to live with it, but it's not so much that, oh, we will go back to the normalcy that we all knew. And for children, I do see teens. I think their sense of normalcy it has been taken away. The school is different. They don't see their teachers, or some kids might be having two different teachers if they are doing hybrid model or whatnot. And kids really do like consistency. They like safety. That's their thriving world. That's how they grow. That's the healthy environment for them. And pandemic has taken all that away from them and from us as well, that we feel like we failed as parents and guardians to provide that for them. So absolutely, it has tested us. And as Dr. Mukhara indicated, depression, anxiety, and other uh, disorders have merged up and have kind of come to the surface, even if people were just kind of gliding by. Like it hasn't really come up to the surface, but they have maintained it. But pandemic has really put them above their threshold. So it has been tested.
Yeah, definitely. I think every single person, subconsciously or consciously has been experiencing a lot of stress this past year, and I think kids have definitely been one of the most impacted, because they may not have the right coping skills. And I think I've doing a lot of research. I think even school counselors, there aren't enough school counselors these days to provide help and support, and so there aren't enough people in the field. Even Virginia district has been trying to hire school counselors and hasn't been able to fill those roles. So I think we're dealing with a large crisis, and not enough providers in this space, which is unfortunate. But
Absolutely. Divya, may I add, like, for school counselors, recently in the last 40 to 50 years or so, school counseling hasn't been what it's supposed to be. It has been just case management. Like school counselors have had like over 200 kids like assigned to one school counselor. Like they hardly can keep up with their class schedules, like what to assign them and what courses in what order, let alone just counseling about their emotional, mental health or physical health even. So I think that has really hit it on its head, that we definitely need to go back to what school counseling was supposed to be.
And to add to that point, and I think even like as you said, like they have just one or two counselors, for that huge number of high school kids that they have, and they also have limitations because of liability of how much they can intervene into the kids' life. They have boundaries of they can only address school related issues. If it is anything outside of school, home related issues, then technically they cannot even discuss too much about it. So they have limitations and boundary of things that needs to be discussed. And also like therapy is something like you build over time, and it is a relationship that has to continue. For a school counselor who has 200 kids, who's meeting sporadically just to kind of resolve the issue that is there for a moment, they're primarily serving the role of a mediator, not really a therapist. So all they do is, from what we get a lot of referrals from school counselors. So all they are doing is, okay, you do have this problem. At this point, you need to see a proper therapist who is in a clinic setting, seeing the patient on a regular basis, or if needed, you need to see a psychiatrist. So their role is more of a referral at this point. And I think practically looking at it, it's even not fair to expect them to do a role of a therapist, because it is not the setting, and there's not enough resources and tool, and it's impossible for one or two counselors to really do that role. And there is also limitations of liability there. So because for those reasons, I think they're just referral sources at this point. And so just to kind of deal with school related issues.
Right. It sounds like they kind of are just responsible for triaging patients and referring them to the right providers. And so, I think it's really important for parents to look out for signs of these, symptoms themselves, because, it's really up to parents to take that initiative to get their kids help, right? So maybe we pivot towards like, maybe we can break it down by age group, but what are the telltale signs, symptoms of mental health decline to really look out for, where it's to the point where, yes, like you should definitely get this person help or talk to this person about help.
I can probably talk about the younger age group and maybe teenagers, and you can probably talk more about the older kids and young adults, and adults in general. So, I mean, in school, the typical things, there are, kids present with depression in a different way. I mean, not every kid is going to present with melancholic type of depression where there's sadness, crying, lack of interest. I mean, that typical pattern of depression may not, I mean, it may exist, but may not be really present in all children. You see a lot of irritability, anger outburst, projection, crying, sleep problems, and also they make comments about not wanting to live. But a lot of times I see in younger children, it's more of a poor stress tolerance that comes from anxiety rather than deep rooted suicidal plan and thought. I see more of those clear suicidal thoughts as they develop more into like middle school, teenage kids. So the common symptoms, as you said, like sleep problems, irritability, not eating well, academic decline for sure, and poor social interactions, fighting with friends. All those are common things that I typically hear from younger age group. And middle school, high school, it's pretty much, you'll see some aspects of this. And also you will hear a lot of sadness, crying, again, sleep problems, sometimes suicidal thoughts, cutting behaviors. A lot of middle schoolers and high schoolers, we see that. Some suicide attempts, some get noticed, some don't get noticed. And also you see, a sense of like lack of motivation, not able to see the future, a sense of foreshortened future, like, always feel like there's nothing to look forward in life. What's the point in doing what I have to do? And sometimes, like, because of bullying and other issues or past bad experiences, they tend to dwell on it, overthink, overanalyze, and so partly, a lot of self-criticism and low self-esteem kind of emerges from that kind of experience too. So sometimes you see kids, when it becomes a little bit extreme, you kind of see them skipping school, getting into drugs, bad associations, alcohol abuse, dependence. All those things also can come into place. So these are like, it's like a general symptoms that I talked about. Again, people can vary, and it's a wide range of symptoms that we are discussing. But the key thing is, if somebody is cutting themselves or talking about, seriously talking about killing themselves, I mean, that is a clear cutoff for me for medication. We'll talk more about the treatment later, but I'm just saying, so, regarding getting help, anybody with serious suicidal thoughts and self-injurious behavior, clearly that would be a time to refer to psychiatrist.
And a quick question before we move on to Dr. Kaur. I just wanted, maybe this will help some people in the audience. What is the age? Is there an age too young to for us to get kids help, or is there any sort of age indication?
So typically I start seeing for medication from age 5. That's the cutoff I have in practice. Really, really severe ADHD, sometimes like younger kids are treated sometimes by primary care doctors, but my cutoff is 5 and above. And so for medication, that's when I start screening patients in our practice.
Okay, thank you. Dr. Kaur, please. For therapy, how you may have a perspective on what is the age that's most appropriate to begin counseling or therapy activities.
Again, Divya, I work with teens and above, but I have seen a 4-year-old in a counseling as well. Those are sometimes rare cases where they might be removed from their home, or maybe some abuse has been reported or something. or really disassociation type of behaviors, obviously then that also indicates some sort of trauma or abuse that might be going on, or kind of suspecting that if it is earlier than like age 4. But anything above age 4 or 5 has been in counseling. I mean, it's appropriate. But I wouldn't speak on children symptoms. I think Dr. Mukhara has covered that a lot, but teenagers, and I'll only cover the ones that I have seen in addition to what Dr. Mukhara has already talked about. With teens, in addition to cutting behavior, what has come across is damaging their belongings. Like recently I had a teenager, young girl, who has damaged her favorite candle, that she's a candle person, and she was actually not cutting herself, but she was cutting her candle. So if you see something like that, that would be a red flag as well. A lot of defiant behavior in teenager shows up as well. I know defiance, sometimes it's like identity development as well, that they are just asserting themselves. But if they are just around, like just rude, not understanding, and just being behaviorally kind of defiant, that might be a red flag as well, that they don't know, as Dr. Mukhara said. Teenagers included, children do not show symptoms of like melancholy most of the time for depression, for example. It is the acting out behavior. They might get, fights in school or with their kids or at the playground or something. So that those are kind of the red flags. And another one is isolation. That if you see your teens not wanting to hang out with their peers, or don't want to have like play dates, or don't go out, they're just sitting in their room, and it's hard to differentiate even with the technology how much we have accustomed to it. But if you see that a couple of these things are lining up, that could be showing up as depression. But for adults, there could be early signs, and then kind of what we say like severe diagnosable signs. So the early signs that we might just ignore and brush it off and say, oh, this is just living life. Those could include like feeling irritable, or feeling frustrated, feeling overwhelmed, feeling angry, or just not being able to catch up with things, or feeling out of control. Those are all signs of like pre-signs of depression and anxiety, which way you go. So I treat, my clinical specialties include mood disorders and anxiety disorders. And anything from like just early signs, and we go deeper into that, these signs may indicate that you have a diagnosable disorder. So if you have consistent sadness, or like not feeling, getting out of your bed, or work and house chores, they just feel like heavy and chores, low on energy, disturbed sleep, just edginess to you, and not connecting with people, and again isolating yourself, not wanting to hang out with your friends or going out or something. All those are signs of depression and anxiety, that you are sort of on the wrong track if you are noticing yourself with these symptoms.
And just adding to that, the defiance part can be either, it can be behavioral, where it can be related to more oppositional type of behavior, not wanting to listen, like have their own independent thinking, doesn't like to be told. It could be, the defiance can come from a behavioral perspective, or it can be part of, sometimes even kids with anxiety can present with defiance because of the rigid thought process. because of cognitive inflexibility. They are not able to think about a situation, in from others' point of view. They have this tunnel rigid thinking. So when people are trying to tell them to do something different, they don't, it's hard for them to kind of understand their point of view, and they want it their way. They become obsessive and rigid, and they have huge meltdowns, which come out as defiance. So these are different aspects. So I know defiance is a common thing that parents keep asking. So I just want to kind of bring that up to know.
Or not being able to cope with change, right? In the last year or so, like
Yes.
we have had a lot of changes, and kids and teens usually they don't yet have constructive coping skills that they can use when they face these challenges, with change and such. So that can also be seen as defiant. Like I don't know how to deal with change, and I don't want to change my way of doing things, and now I'm gonna say no.
Yeah, I think, to sum things up a little bit, there's a wide spectrum of symptoms that, it presents differently in different people. There's definitely some telltale signs that we can look out for. But I think when you know someone, I think you can kind of, when it presents differently in different people, if you have a sign or, you feel like something is off, it's, say something, see something, say something, right? So I think it's important to just, keep your eye out for things that, like changes that you're seeing that are consistent, and just sometimes just offering a compassionate voice to people can really help them maybe even come out to you about it and speak more about it. And I think this segues into like, how do you talk to someone and how do you help them? I know sometimes getting people help, they're like, you think I'm crazy, or do you think that it could be met with defensiveness or denial. And with kids, it's, as parents we can get them help, but with friends or colleagues or even parents, elderly parents, I know that this pandemic has been very hard for geriatric folks who don't who don't have people who can check up on them in person. And so but there sometimes is resistance to acceptance to getting help. So what are some techniques or ways that in, again, broken down by like age groups, like how we can approach conversations to getting help for someone?
So I think the main question is more towards adult. I think, is that right? Maybe Dr. Kaur can answer that. Is that the question, Divya?
Yes, because I think as kids, as it's more of a parent-led thing that, as maybe ways to
For
talk
as a
to kids
colleague.
about what, yeah.
Okay, sure, I'll take that. I think when we want to kind of bring someone around to getting help, the biggest thing that they would be afraid of is being judged, right? So that is big on their mind. So anything that you can do to put them at ease, or create that safe space for them to maybe initially just vent, or if they initiate, right? But if they don't, then maybe just kindly asking like, hey, I have been noticing you are not yourself lately. Is everything okay? And then might open up the door for a dialogue, because what you really want them to be at is for them to decide that, hey, yes, I don't know how to deal with this, or I am going through something and I'm not feeling well. Maybe they just need somebody to kind of tell them or hear their story initially, because of the stigma, because we really don't go for counseling. Psychiatry, even in India, is much more acceptable than counseling and therapy. Like, how are you gonna really treat someone by just talking to them? Like, so medication is like authority, right? That's something solid that you can give them to take, that has the belief that it will make me feel better. But just talking or counseling, it's stigmatized to a new level. But if you can in any way make them feel safe and secure to express what they're going through, I think you would make big strides to get them the help that they would need, so they don't feel initially judged, and they might be open up to talking to someone that they are suffering, or that they're not doing well. Dr. Mukhara, you had something.
Yeah, to add to Dr. Kerr's point, the thing is, studies have clearly shown for depression and anxiety, like mild to moderate, the CBT technology works as well as medication. They're actually in par, but only when it comes to moderate to severe, of course, medication medication is needed at that point. But so that's the information people have to understand. The techniques that are used in therapy, these are proven proven methods. There's huge research that's done. It's not just talk therapy. These are people who are trained in different programs, very knowledgeable, skilled people who are, who are trained in these specific techniques. And, again, as she was mentioning, the result of therapy is a work from the patient too. Right? If they are not putting that effort, no matter how skilled the therapist is, we are not going to see the results. But the important thing for them to understand is for disease conditions like depression and anxiety, and even OCD, therapy really has a strong role. And as I said, for the earlier situations like mild to moderate, they are in par with medication. And only beyond that, medication kind of takes control. And of course, therapy is needed all the way through from mild to severe. It is part of treatment all the time. So therapy should never be ignored or should never be undermined at any point in treatment. That's what we talk about. That's definitely a recommendation to patients all the time. But certain conditions like it's like ADHD, things like that, are kind of more biological, and of course medication kind of takes a little bit upper hand for those conditions, but still therapy still plays a very big role, where they working on executive functioning like organization, study habits, things like that. Because just focusing and processing, which is helped by the medication alone, is not going to bring the results. There should be a discipline of learning and organization and study habits, which is going to add to the focusing in order to bring the results. And I think that's where therapy is going to be needed in all areas of psychiatry, no matter no matter what medications we use. And so that's the part I think people should understand and seek out therapy as the first line, I would think. And when the therapists feel like this is something that medication should be added, then then they should be referred to psychiatrists. And that is how we do in our practice. Initially it'll be a therapy consult, and when the therapists feel like they need more help, they come to us. So yes.
Yeah, I really love hearing you both supporting one another, because it's not one or the other. It's not, they're not, you pick one or you pick the other. They really go hand in hand. Treatment is not a one size fits all for people. It's something that, it works differently for each individual, right? And it's really to start by getting help to talk and then diagnose a certain person, and then go to see like what options could work. And I think everyone takes different options differently. They impact people differently. And I think this is a great like starting point to talk about like what are the treatment options, right? We've kind of talked about it. There's psychiatry, psychology. There is a holistic portion to this that has been shown to have strong correlations as well. So maybe we do you want to start, Dr. Carr, with the first part of it, and we'll...
Sure. Thank you, Divya. Yes, as even to kind of going back a little, as the best of all is, as Dr. Mukhara said, counseling therapy and medication from moderate to severe even. And most of the disorders are on spectrum. So as a counselor, I would say, look for the preventative measures, the self-care, those practices are really needed to keep anything emotionally disordered functioning at bay, right? So counseling or therapy, those are like with the early signs of like, oh, I am not doing well, so go for that, and don't even allow yourself to go to the moderate to severe level of any disorder to seek help. That would be my one thing. If you want to take away, like, for your mental health, it's everyday practice. You do it with your self-care, boundaries, and putting yourself first. And if, I usually teach my clients, and it takes a long time for them to really catch up to it, that if you don't have your mask on, no matter how skilled you are, how good of a worker, mom, dad, or whoever, whatever you are to your family and to your work, you are no good, right? So learning, it takes a heck of a lot of learning to make sure that you have your mask on first. And that could go into many different type of holistic options or holistic treatments, from just getting a massage once a month can improve your sleep and blood flow and other functions of your body. So that could be just being able to read, or kind of doing music or dance, or something that really brings you up to light, or lights you up. That those things are the at the self-care part of it, that the preventative measure. Then you can look into acupuncture or aromatherapy or other types of kind of treatment maladies, whether it's nutrition, keeping up with your fitness level. As Dr. Mukhara said, like CBT for mild and moderate depression kind of pretty much compares to medication as well. And I usually say, like, if you don't want to come to counseling, make sure you keep up with your physical activity, because just having like 3 to 4 days of consecutive good physical workout, that can also be a very good alternative for a mild depressive, as a kind of mild depression alternative as well. So there are like just a number of things that you can try and keep up with, but I would say self-care practices as preventative that you want to look into.
So I don't know if you want to add medication wise, as I said, it's going to be moderate to severe situations. When it comes to depression, I mean, there's really, it's like a wide category of medications, different classes, and it's really hard for me to talk about everything. But I just want to just say one point here. As I said, like, as I mentioned earlier, like when if you see people cutting themselves or having, if they have active thoughts with plan, of course they have to go to emergency room right away, but if they have like just like hopeless thoughts and just no point in living, but really would not do anything, not necessarily they will kill themselves, like a lot of hopelessness, self-injurious behaviors. When it comes to that level, a lot of times we have to look into medications, and a lot of these medications, of course, anytime when it comes to medication in any discipline of medicine, it is all about risk benefit ratio. It's not, even water, if you drink a lot, you can have hyponatremia and you could kill yourself, right? So every simple thing, it should be done with careful monitoring, and that's why it's a prescription and it's given by a doctor. So, the key to remember here is, there are some side effects that may or may not happen. A lot of times with the typical medications like SSRIs, there's really majority of the people don't have side effects. And, and a lot of these medications have saved lives of people. They really have saved people's lives. And, that is why it's in the market. And I know there has been some, people who don't understand about medication, they talk about, all these meds can kill you, all these, there are a lot of things that people say, not understanding what it can do. If it is really dangerous, FDA is not going to let that medication in the market, especially for a child. There's no way. And another thing I want to also discuss is the ADHD medications. There's a lot of misunderstanding about ADHD medication. And the important thing I want to mention here is, especially ADHD is really a biological condition. Among all the health conditions, ADHD is one of the highly researched area. I mean, the amount of research that has gone into ADHD is huge. And clearly the studies have proven that the medications make a huge difference. So the problem with the ADHD kids, it's not like a kid who is jumping around hyper and not able to just sit and learn. It's not, that behavior is there. In addition to that, these kids they struggle with how they process information, how they are able to hold in, do calculations, the working memory, all those things. There's a clinical biology component of the brain not able to do certain areas of learning, and that can be corrected only by medications. And that's where learning becomes easier. So it's important to understand a kid who is struggling with learning, and all we are blaming the kid is like, you're not responsible, you're not studying, you should just sit and learn. And then the kid is not able to learn because it's really a biologic process of the brain. And then sitting in school all through the day, struggling with learning, being blamed by parents, being even like looked down by peers when you don't do well. It's like almost like a majority of a kid's life in school, if they are going to go through this kind of pain, it is very natural to expect this kid to become depressed eventually. And so when kids studies have also shown that untreated ADHD leads kids into depression and substance abuse, and and other wrong behaviors. This is a proven fact. So for that reason, it's important to treat these children. And I have like, if any medicines, like among the medicines that we have used in psychiatry, I would say ADHD has almost 90% efficacy. If there's a right diagnosis and if we give the medication, it really makes a difference. And only a few situations where I would have to switch into something else is side effects. It's not because it's not working. Even at that point, it is doing something that is beneficial, but the side effects and the intolerance to certain medications is why we would switch into something else. And I have seen, if there are no other factors that are affecting the cognitive aspect of the kid, if it is purely a focusing issue, I've seen really kids, when addressed with right medication and right dose, go from like below average grades to straight A's, and they have become very successful. And that is, I see in and out. I see, there are so many parents who come back and tell me, my kid is the way he or she is doing well today only because this change has happened in her life. So I think it is important for parents to hear that. I don't want them to misunderstand about medications. A lot of psychiatrists, any psychiatrist, but especially child psychiatrists, we are all very careful about medications in children. It's only used, we don't want any kind of medication for children. I mean, we all are on board with that. I mean, that's just how, as parents, we all think. But if this medication is going to put my kid in the right path, and if this is going to make her help her lead into a success, then I think it's all worth it. As I said, it's all about benefit risk ratio. And so that part I really want people to understand, because I know ADHD is a very common condition. I think in Indian community, I don't think every kid gets help. There are some kids who do get help and they do well, but a lot of kids are being blamed as being mischievous, or not being studious, not being responsible, and being blamed. And I feel like if these kids get the right kind of help, they will probably be in a good path to success. So this is something I really want to make sure that I bring it up. Otherwise, as I said, medication is such a wide area. It's hard for me to even describe anything. Unless people have any specific questions at the end, I will be happy to answer that.
Sure. Thank you.
Mhm.
Yeah. No, thank you so much. That was a really thorough explanation. There is neuropharmacology. There's a lot, so I know it's hard to cover all of that. I think one term that I think both of you have used is CBT. I don't know if maybe everyone knows what CBT or cognitive behavioral therapy is. Dr. Kaur, if you want to cover that for a couple of minutes.
Sure, Divya. So CBT is cognitive behavioral therapy. So it's kind of in a short term, restructuring your thought processes. Sometimes with anxiety and depression, we get stuck with certain thought processes that just by changing them, by becoming aware of them and then kind of neutralizing them and then changing it to maybe more so of a positive one whenever you feel ready. That's kind of restructuring your whole belief system as well, instead of just focusing on with obsessive compulsive disorder or personality disorder. So people tend to focus on like a tunnel visioning, and that's the only one thing that you kind of get stuck with.
Yeah.
And then you just like, yes. So what we would do is any counselor would do is to kind of help you identify your malfunctioning beliefs or your malfunctioning thoughts. And then first step is to kind of neutralize it, not even a negative or positive, or just to kind of observe that, just is it this way or that way, the way you are looking at it. And then to kind of change it a little bit more slowly into a positive one, so people can start to be a little bit more optimistic, because around depression, it's a lot of pessimistic type of thoughts that we work with.
Yeah. Okay.
And in children, I want to just add that in children, like I see that kids with anxiety, the natural tendency of an anxious brain is to always think the negativity in the situation. It's the optimistic thinking is really not there. Always they look at what's not there, what's, the empty side of the glass is what they look at. Right. So, the brain has this automatic thought process, like with any situations, anxious brain always tends to lean towards the negative thinking, and over time it becomes a habit. So everything that you do, like, automatically you're going to assume the worst possibility. And so as Dr. Kaur was saying, like, the restructuring that thought process, right? Learning, helping them correct the thought process, like when certain situations happen, like instead of thinking this, what are some of the other things you can think? So retraining them to think positive repeatedly, eventually, as we all know, like behavior is habit, habit is character. So over repeated, training, they learn, and that those are proven methods. And as she was mentioning, that is where I feel like people have to understand that, this is a work from their side also, but it is really a very, very effective method, and I see a lot of people, a lot of patients who get better with the CBT. So it's important for people to know that also. Yeah.
And if I also may add, when you are stuck in a negative thinking pattern, what starts to happen is that, yes, we have an anxious mind is going to automatically look for danger, right? We are reptile, we have reptile brain, and we are wired to look for any danger signs to our survival, right? That's just fight and flight system. So that's what we go back to, that I need to survive, I need to feel safe. And over time, what happens is that those negative patterns start to come like self-fulfilling prophecy, that you start to kind of see like, yep, that negative thing happened, so now this is going to happen. And so you just start to kind of see the glass half empty, because now that's becoming your safer zone, right? If I don't put myself out there, then, like, for example, for social anxiety, that I don't have to deal with the unknown, right? So I am safe here, so I'd rather just be here. That's to avoid, that's what you usually are challenged to work within like a CBT type of modality. So it's not only just to treat that particular disorder, but as Dr. Mukhara said, it's behavior is habit, habits is character. So once you learn these coping techniques, and you can automatically on your own try to restructure your thoughts, your life changes, like just how you see and view things, that has a snowball effect on just rest of your life, because that's a skill. It really is a skill, even to learn to be an optimistic person.
Yeah, those are great explanations for sure. And I think hopefully people, if you guys have questions, please start, put them in the window. Just one more thing before we move on to our Q&A, and that is, what are, and I'll cover a few things, and please feel free to add on, but what are some affordable and accessible ways of getting help? I know a lot of employers offer EAP, which is Employer Assistance Program, for them and for their dependent family members. There's BetterHelp, Talkspace, Heads Up, and Calm app, which are two like meditation apps, which are very helpful. Teladoc, which a lot of virtual healthcare services like Teladoc, MD Live are offering both counseling and psychiatry, as well as just holistic options. I know we covered acupuncture and exercise, but there's meditation, as I mentioned, yoga, any other like lifestyle changes. So anything else to add? I was just covering a few, but
I was just going to say, like, if they want to understand about any mental health conditions, or sometimes to understand medication, things like that, the American Academy of Child and Adolescent Psychiatry their website is very good. It's authentic and updated, and it's very reliable. They have nice educational materials on different mental health conditions, and also I think about medications, like everything related to psychiatry is there. I'm assuming even American Psychiatric Association website should have that, but I know for sure ACAP has it because I've looked at it. So, that would definitely will be a good resource. And they have like fact for families, which we can print and give it to patients also, about different conditions, just to help them understand just the key things about different disorders and things like that. That is definitely a very reliable resource that people can look into if they're interested. Yeah.
And from more of a research point of view, I would say National Institute of Mental Health, they usually have really good articles explaining each disorder and what you can expect from symptoms and the treatment and modalities, and research-based which treatment modalities, particularly like for on a counseling talk therapy side, have been very effective. And another organization is NAMI, the National Alliance on Mental Health. They also have some good resources, articles, and an education knowledge base on mental health, and a lot of statistics as well. When you put it in like 1 in 5 in Americans are affected by depression, and you look among yourself, like we are 10 of us here in this room, and 2 of us have, according to the statistics, some that suffer depression or is suffering depression. So that also kind of those type of statistics I feel like are helpful to put things in perspective.
NAMI definitely is a very good resource, I think. And for Loudoun County, the Loudoun County Services Board, the Mental Health Services Board, they have, they actually, I think they have a crisis center where somebody, if they are actively suicidal, things like that, they can, I think they do assessment. It's Crisis Intervention Center, something like that. I think you can look it up in their website. And they also, I heard that they also have like like support groups and things like that. This is through the Loudoun County, Mental Health Services Board. So their website, you can definitely take a look at their website, and they may have support groups and things like that for people in the local area to get help. I'm sure that would probably apply for Fairfax County too. So
Awesome. Thank you both. So definitely a lot of channels to get help, and a lot of ways to do so. And I think we can open it up for questions. I see a few in the window, so I'll start with asking one. Krishnakant, who is our he's part of our VT Seva board. His question is: as a nonprofit organization committed to community service, what initiatives can we take to raise mental health awareness? Similar to seminars, anything that works well with educating the community, that sort of thing. Any thoughts?
I think, I mean, the best thing is, of course, the seminars and things like that. And the more they know about the condition, they're going to be more open to reach out for help. The resources, I think, definitely, your primary care doctor is a big resource. If you are not comfortable, a lot of times people are hesitant to go to a psychiatrist first line, because as I said, it's just that clinic that itself they get scared to enter into the clinic for some reason. It's actually not any different than any other clinic. But for some reason, people are kind of, nervous to reach out to psychiatrists as first line. But I want you to know, like, primary care doctors they deal with a lot of depression and anxiety. Like 70 to 80% of SSRIs, like the antidepressants, are actually prescribed by primary care doctors. And I get a lot of referrals from pediatricians and family practitioners. So definitely go and talk to your primary care doctor, and they can definitely guide you. They can assess the situation. They have expertise in the area. They can assess the situation and get the right kind of help. If it's therapy or medication, they definitely can help you out. I think just increasing the awareness by educating the community whenever possible, and then reaching out, as I said, primary care doctor would be definitely the first step if they are even hesitant to reach out to a psychiatrist as first line.
Yes, that's a really good resource. But as a nonprofit organization, I would say, yes, the seminars like this, they are great just to have a dialogue so people's questions can be answered. Maybe like a blog or something on your website, just a little small corner that just says, you are open to having the dialogue. That can also just make people safe, that some people don't even want to identify themselves as, oh, I need help, but they can just find information if they're associated with you online, and maybe over time they can have this, and that they can take the next step.
Yeah, that's a great idea. That's a really good idea. We have another question, is what is your stance on self-diagnosis, especially in the age of social media?
That's a very interesting question, because people always do that, right? People, they put in the diagnosis, but if you type in a diagnosis, you'll get all possible diagnosis in the, if you put in a symptom, you'll get all possible diagnosis in the world. I mean, I feel like psychiatry is not, it's slightly a different version of medicine, because it's an art. You just cannot make a diagnosis based just on symptoms, right? Because we are looking at functional aspect of the brain. It is not like, it's not a structural aspect of the brain. It's not like you take an MRI, you see, of course there are changes that could be linked to psychiatric conditions, but it's not like you have a tumor and okay, you see a connection, you have, a neurological symptom, so you can all connect it logically, right? So it's not like that. It's a function of the brain, and function is assessed by, how they interact with people and how they function, and that is an art. And so assessment of that, so it's kind of hard to make a diagnosis based on the check mark of symptoms. So definitely, I think definitely for psychiatric condition, do not Google, because it does not make any sense to come up with a diagnosis just by Googling. You will never come up
Yeah.
with a diagnosis with Googling. It'll scare you more than anything, I can tell you that.
And I totally agree with Dr. Mukhara. If you are going to Google, which we all do, right? I would say just to use it as informational based and knowledge based, that if you see some of the things that, hey, yeah, I have experienced this, and I am not feeling well, maybe just to rule things out, go talk to, just to get encouraged enough, if you are going to Google things, to go and talk to someone, to maybe it's just as Dr. Mukhara said, go just to have a talk with your primary care, or a counselor if psychiatry or kind of getting medication for your brain scares you. But just counselors, therapists, they are fully equipped and skilled to diagnose, not to prescribe, but to diagnose. So it doesn't hurt just to go and talk to someone and see like if something is there or not. If you are going to Google, that would be the only thing that I would say if you are going to search it online. Use it for knowledge based, as to kind of encourage you to keep up with your health.
Yeah, I think in the age of social media, it's very easy to look at something and see and think that you have it. I mean, I guess it doesn't just relate to mental health; it relates to any kind of health. So, use your. It's so easy to get help these days. Teledoc and all these services that all our employers are providing make healthcare much more accessible than it was pre-pandemic. Is my feeling. So. One more question around, so Kiran Vangla, he's our VT Seva president. He has mentioned, my very active 8-year-old has been diagnosed with psoriasis due to stress COVID, school from home, and is not able to meet his friends. How, as a parent, can I help him to not stress?
That's your territory, Dr. Mukhara. I'll let you get that one.
I mean, again, you need to understand where the stress is coming from. If it is social, you probably want to minimize the social stress by creating more avenues to improve that, right? First, we need to understand the reason for the stress, where it's coming from, and try to alleviate that. A lot of times the reason the psoriasis exacerbation is because of, stress, immunosuppression, and because of that, right? So of course, you're going to address the psoriasis directly with the dermatologist. But if I just try to see, is school stressful? Is there social stuff going on? Is the family situation is stressful? Try to first understand the triggers of the stress and see how that can be addressed. So it's going to be multiple levels of exploration, and each should be addressed specifically. It's going to be it's not easy to generally say, okay, talk to your kid and it'll be fine. Talking is the first step, but by talking, we're trying to understand the reasons and then trying to alleviate the reason one at a time. So that is the basic principle, but this is a general discussion, so I think this is going to be, it has to be explored more and dealt in multiple sessions more through therapy. But that's kind of the key there. You need to understand the reason and then address it specifically.
And if I may add to that, if you know for sure that the condition is due to stress, maybe looking for a play therapist or something like that would be really beneficial before even considering any sort of medication or anything, because it is coming down to his coping skills, right? And he needs to learn that. As to defining the source of stress, play therapy for kids is wonderful. It's a sandbox or other types of play that the psychoanalysis type of techniques and modalities are used to make connections, that how kids are interacting or they are playing and doing things. So I don't work with kids, but I would say that those modalities are great if you know that the condition is due to stress, and what you can do to see and kind of diagnose where the stress is coming from. and play therapist would be wonderful to even giving and educating as well as teaching new coping skills to your child.
So unless sometimes if people have tried therapy avenues and they're not able to, if they're not seeing a benefit, they've tried few months of therapy and feel like it's not getting better. So in some situations, the anxiety, when it is biological, sometimes, in very younger kids, I see that, the fear, like you'll see the same kind of fear in the same 5-year-old in different homes. And that's interesting to see because that is biological. Because same, it's like the same kind of fear. Somebody's going to come and kidnap me, something is going to happen. The same nature of fear happens sometimes in children, younger children for this, with the same age group in different homes. So some of the biological anxiety, like I've seen parents, like, we have tried different methods of therapy, but it's not working. And those conditions, it's nothing to do with the therapist or nothing to do, it will not work because it is biologic. In situations like that, a small dose of SSRI will be helpful. And then of course, as I said, therapy is going to be part of the treatment all the time. And, play therapy is a very good modality for younger kids who don't open up, because always, like, you have to play with the kid in order to make them open up. Just question and answer is never going to work, especially in that age. So definitely that is a great modality, to be added. As I said, if therapy is not working, then a little bit of medication will probably add a value for a situation like that.
Thank you. Yep. Thank you both. I'll open up any other questions if you want to come off of mute as we're wrapping up here. Anyone else have anything they'd like to ask?
Yeah, Divya, thank you very much. Thank you, Dr. Mukhara, and thank you, Dr. Kaur. The one question I have is, when we talk in like a friend's setting, every parent talks about like the symptoms you have discussed. So when they open up, like in the social discussions, my kid. So what are the things like which we have to take it serious and act on? So what is the fine line? What is the street point to distinguish between a situation we need to take it to the next level?
So, so of course, the safety is the first thing we always look for, right? If the kid is talking about, wanting to kill themselves, or if there are behaviors that are pointing in that direction, definitely an immediate intervention is needed. And, sometimes certain phrases and words are commonly used by high school kids. And sometimes I feel like, that, and parents may feel like, okay, he's just he's upset, he's stressed with the situation, he's just using this word loosely. Sometimes parents tend to kind of shrug it off or undermine the situation because it is perceived as a common word used by the kid for that situation. So the key here is, see, always, like, symptoms is, when we talk about a psychiatric disorder, it's the functionality we look at, it's not the symptoms. People, everybody in the world have some form of symptoms. Like, you feel sad sometimes, you feel anxious sometimes. So it's not the symptoms we are looking at. It's how the degree of the symptoms and how it's affecting the functioning is the measurement for treatment. So if there is impairment at school level, social level, and at family level, then, that meets the criteria for the diagnosis. And that's when you get help. So you look for social impairment. So let's say, like, kid is depressed to the point where he's not able to keep up with school work, or maybe he's smart enough to keep up in spite of that, but there's a lot of family dysfunction, like fighting at home, a lot of acting out at home, like fighting with friends, like socially he's not doing well, then something typically is not right. It's not necessarily he needs medication right away, but at least it's something to be looked into, where at least he can have a discussion with the therapist to begin with and further explored. But if you see a kid clearly cutting themselves, things like that, I mean, it's that you have to rush and get help. And if you hear kids talking to their friends about, I tried to kill myself, I'm thinking about doing it, any of those comments, you definitely want to at least get them assessed. You don't want to kind of, kind of take it easy. Maybe he's just stressed and saying something. You don't want to do that. At least you want to get it assessed. And unless, the evaluations are so intense and thorough, unless they see a real need, people are not going to add medications or throw medications like that. It's not how it works. So I don't want people to be hesitant to ask for help, because, we know even in our own community, we have lost some lives of children, unfortunately, because maybe the resources was not available for that time. So the whole idea behind all these platforms is to make sure that maybe somebody, even one person, will listen to this and get help and can be saved. That's the idea. So so this is the criteria is functioning. Functioning is the criteria.
Yes.
Dr.
And I
Mukhara.
totally agree with Dr. Mukhara that safety is the first, and that's what you really want to look for. And if those remarks are made, what we usually are trained to say or kind of ask, and not to brush off the word suicidal, just to ask for it. And plus, as Dr. Mukhara said, nobody's going to push medication on you. Nobody's going to push anything onto you. And as long as nobody is in danger for their health and well-being, all treatment is your choice.
Thank you. Any other questions from the audience before we wrap up? Questions, comments? Okay, so I just want to say, a very heartfelt thank you to both of you, Dr. Kaur, Dr. Mukhara, for joining us today. I think that I actually you took the words right out of my mouth, Dr. Mukhara, when you said, if this even helps one person, if even one person's life is saved or one person is benefited from hearing this, or you pass on this information to others, there'll be a recording available afterwards. So please, send this to your friends and family. I think that all the information today was exceptional. I think, everyone, I've gotten a lot of feedback just through messages in the past, half hour, that everyone's really been enjoying this. And, so given it's Mental Health Awareness Month, we really want to project this into our communities as much as possible and really, help as many people as we can. So thank you both so much. This was amazing. Thank you for your time.
And yes, thank you, Divya, for doing such a wonderful job, like helping us mediate through this. And thank you, Dr. Kaur. It was very nice meeting you. And I was reading, like the wonderful work you have done and, all your expertise. I'm sure, I hope if you're doing virtual, I'm sure I will be able to use some of your resources for my patients too. And very nice meeting you.
Yes, thank you, Dr. Mukhara. It was great meeting you as well. And thank you, Divya, for making this all happen and thinking of me to join you guys to answer these questions and have this talk, and much needed talk, especially during this pandemic period. So thank you very much for having me here.
Yes, thank you again. Thanks, everyone. Have a good rest of your day. Take care. Bye.
Bye. Good night.
Good night.